Hello, everyone, and thank you for joining us today. I'm Andrea Jensen. I am the Interim Director of Education for Allergy and Asthma Network. A few housekeeping items before we begin. All participants will be on mute for the webinar. We will be recording today's webinar. So this will be posted on our website within a few days. You can listen to it again, or you can share the webinar with a colleague. You can go to our website at allergyasthmanetwork.org. Scroll all the way to the bottom of the page and find our recorded webinars and any of our upcoming webinars. The webinar will be 1 hour, including time for questions. We will take those questions at the end of the webinar, but you can put them in the question tab at any time. We have someone monitoring the chat if you have questions or if you need help. You may notice we are using a different platform this year for webinars. This means we also have a new way of giving you a certificate of attendance. The day after the webinar, you will receive an email with resources about digital health, a link to download your certificate, and information about how to obtain CEUs for this webinar. We will now begin today's webinar. Digital health and technology have changed drastically since the pandemic began in 2020. Telehealth can improve patient health and reduce costs for patients and providers. It makes medical care more equitable and accessible to patients in medically underserved communities and in rural areas. It's important for allergists to understand how digital health can be utilized in their practice and how it's being utilized in direct-to-consumer business models. Today's webinar helps us live out our mission to end the needless death and suffering due to allergies, asthma, and related conditions through outreach, education, advocacy, and research. Today, it is my pleasure to introduce our speaker, Dr. Payel Gupta. Dr. Gupta is an assistant clinical professor at both SUNY Downstate Medical Center and Mount Sinai Medical Center in New York. She is triple board certified and holds certifications from the American Board of Allergy and Immunology, the American Board of Internal Medicine, and the American Board of Pediatrics. She is the medical director of allergy, asthma, immunology, and ENT at lifemd.com, co-founder and medical officer for getcleared.com. She is owner of Ease Allergy Clinic in Brooklyn, New York, treating both adult and pediatric patients with asthma, environmental allergies, allergic skin conditions, immune disorders, and food allergies. She is also a member of the Telemedicine Task Force for American College of Allergy, Asthma, and Immunology. She is the immediate past president of New York Allergy and Asthma Society and a volunteer national spokesperson for the American Lung Association. She is co-host on the Itch podcast, a podcast dedicated to helping patients understand their allergic conditions. And with all of those, I'm surprised that you have time to sleep, Dr. Gupta. Thank you for being with us today, Dr. Gupta. We look forward to hearing about how you can use digital health to really help your patients.
Thank you so much for having me. I'm really looking forward to talking about this topic. So, my disclosures are that I am a speaker spokesperson for ALK Advisory Board, participate for Sanofi, Blueprint, Johnson & Johnson, and of course, the medical director of direct-to-consumer telemedicine company. So I guess everyone should know that we're going to record today's webinar. And this information was already kind of discussed. So today I'm really going to be kind of outlining what is the aim of telemedicine and kind of coming to a conclusion of what is the aim and how did we get there. And so I'm kind of going to do it in a storytelling way where, I think everyone in 2019 was kind of a skeptic, and then COVID hit and we became non-skeptics, and then we became converts. So, the skeptic. So what are the questions that people ask often? There are many pitfalls of telemedicine. How can you connect with patients via virtual care? They won't like it. The technology needs to work for patients and physicians, and it's going to be too hard to come up with that technology and make sure that it works for everyone. You need a license for multiple states. And you can't examine a patient through the internet. So how is this going to work? How does telemedicine work? And then the definitions are confusing. There's digital health, which means that electronic and telecommunications technologies and services used to provide care and services at a distance. Whereas digital medicine is what we're really talking about, which is the practice of medicine using technology to deliver care at a distance. And where the physician is in one place and uses telecommunications, and there's various telecommunications, and we'll talk about that, to deliver care to a patient at a distant site, like their home or their office or their car. And digital therapeutics are evidence-based, clinically evaluated software and devices that can be used to treat an array of diseases. And then there's synchronous telemedicine, which is scheduled real-time interactions by phone, video, or in person. And I think those are the ones that we're most familiar with. But then there's also asynchronous consults, which happen on your own time and don't need scheduling. And the communication is done by text, email, or a HIPAA kind of validated or secured portal. And there's store and forward information where you can send pictures, other things to your physician, and that's stored and then evaluated at a later time. And there's also diagnostic test interpretation done in this way. So Dr. Portnoy is one of the pioneers in telemedicine for the allergic patient. And he put together this really great, I think, infographic that I really love, where it kind of shows you the different ways that you can have a visit with a patient. So there's in-person visits that we're used to. Then there's the store and forward, where the patient, where you get data from the patient, like spirometry data, and it's stored in the cloud, and then it's sent to a provider in a distant location. There's also remote patient monitoring and then there's remote therapeutics monitoring. And so that's where you're using wearables and digital inhalers and things like that, and putting that information in a set location and then transferring that information to the provider for review. And then there's telephone encounters, which we're also used to. And then there's something called direct-to-consumer healthcare, which also kind of took an upturn during COVID. And I personally was a big part of direct-to-consumer telemedicine, and that's a big part of my life with LifeMD. And so that's another way where it's the consumer is just going onto a website and deciding that they want a particular medication or they have a particular question, and then they can directly from their computer to a distant provider communicate and get a consult. And then there's these facilitated integrated visits, where a patient in a remote area might travel to a facilitator location where there's a nurse or other provider that can help do different exams, different diagnostics, and then send that information to a physician at another location. So those are kind of the definitions and kind of the big picture and all of the things that everyone was thinking about in 2019 and before 2020 hit. How are we, what does it even mean? And it's never really going to come to fruition. But then March of 2020, when COVID hit, everyone started to think differently. And we started to see empty waiting rooms. And all of a sudden, we had, from less than 1% of visits being telemedicine, as high as 80%. And I think almost 100%, I mean, for me, during the pandemic. And so that's a 63 fold increase between 2019 and 2020. And then, and so the college actually did a survey during this time, and even between, and there were some shifts, right? So April of 2020 to August of 2020, we saw 30% in-person visits to 66%. So there was a shift going back towards seeing patients in person after the kind of big peak of the pandemic hit. But you can see that it's still higher than that 1% that we were seeing, less than 1% that we saw before April of 2020. And in that survey, they also asked, do physicians, and these are allergists, plan to continue to use telemedicine in their practice? And 90% liked it. 90 out of the 258 responses, which is a lot of practitioners, they liked it and they plan to continue to use it. So I mentioned briefly clinical telemedicine versus direct-to-consumer telemedicine. So what I mean by that is, in the clinic setting, we think about telemedicine, the synchronous consults, and that kind of model, which we got used to during COVID. But there's also another model, this direct-to-consumer telemedicine model, which allows patients to get streamlined access, where they're filling out a medical intake form, and then that information is being sent to a physician, and then that patient is getting prescribed medication that's being delivered to their home. So they're technically never seeing that provider physically, and also maybe even not seeing that provider over a video consult. And mostly the direct-to-consumer telemedicine is being done in that asynchronous fashion. And I think a lot of people have seen Hims and Hers and a lot of these companies that kind of started off more in conditions that were embarrassing to patients, like erectile dysfunction, men's hair loss. And for those medications, patients were seeking a different way of getting their health care so that they wouldn't have to physically see anyone to get medications that they thought that they needed. So, and then, we did see an uptick of companies that are providing allergy care in the direct-to-consumer world. And I was a part of one of those. And so it's an interesting concept. And just from having lived it, I think it's actually much needed. A lot of the direct-to-consumer patients are actually patients that don't have insurance for various reasons, or are between insurance plans, and they're just looking for alternative, more cost-effective ways of getting their health care. And then, I really became a convert. And I think that telemedicine, there's this report that was put out that telemedicine really addresses the shortage of allergy specialists, especially in rural and underserved urban communities, and facilitates patient access to allergy services. And I truly believe that. And I think that there's so much data to show us that there's ways that we can provide care to patients that's equivalent to in-person care. And so there was another survey done by in conjunction with the American College of Allergy, Asthma, Immunology, and the American Medical Association. And these are the physicians that filled out the survey. 61% were in suburban locations, 29% in urban, and 10% in rural. Mostly physicians in single specialty physician's office, some in solo practice, teaching hospitals. So it was a nice mix of really where our specialists are mostly. And 92% of patients said that they currently use telehealth. So again, it's continuing to be used. And whether it's, I think, again, most practices are doing a combination. They're not just doing telemedicine. They're doing a combo of telemedicine and in-person visits. And that survey that the college did for allergists on how are they using telemedicine in their practices, you can see that most of the visits are for follow-up patients. So you can see for follow-up asthma, it's 80% versus new 28%. Follow-up food allergy, 91 versus 51. Follow-up allergic rhinitis, 96 versus 56. So all of these, the follow-up visits are more than the new patients. So physicians feel more comfortable seeing their follow-up patients through telemedicine than they do seeing new patients. And so what are the benefits of telemedicine? So for the physician, there's multiple benefits, and for the patient, there's multiple benefits. So for the physician, it frees up office space to see more complicated patients for testing and procedures, expands office hours without increasing office overhead, and it allows for reimbursement for follow-ups and fewer no-shows. So I know in my practice, the small practice that I have in Brooklyn, I really do just use the office space hours that I have for testing, and patients that just need follow-up, for example, for blood work, or just to see how their asthma has been doing, or refills, they can all be handled through telemedicine. But for that new patient, or that patient that needs testing, that patient needs to be seen in person. So, but the great thing is that through telemedicine, and one of the benefits of COVID is that we started to see more reimbursement for this, but now we have a way of actually getting paid for those blood work review visits. And whereas before we were doing those phone calls, we were having those visits without getting paid. So there's a lot of physician benefit, I think, of telemedicine. For the patient, there's a lot of benefit too. For example, no need to travel, no childcare issues, no need to miss work or school, quicker to book, quicker access to appointments, lower cost reduction for visits, meaning, you're not taking a day off, you're not driving, you're not spending money to, get to the appointment through subway, bus, whatever it is. And so you're gaining time, because the average time that you're saving from having a telemedicine visit versus an in-person visit can be as high as 4 hours and 30 minutes. So, for the patient, this makes a lot of sense. And obviously it has to be for the right visits and for the right conditions. But I think for the allergic patient, telemedicine can be used in so many different ways, and we'll review that now. So one of the pitfalls that we discussed early that people were concerned about is, how can you connect with a patient via virtual care? They won't like it. Well, actually, the data doesn't show that. The data shows that there's actually better outcomes, increased compliance, and decreased no-show rates, and similar outcomes. So chronic disease patients have better outcomes when a specialist is able to care for them. So having better access means better care, and means that patients will love it. And then increased compliance for patients with asthma after telemedicine visits. So meaning that they understand their condition better, potentially, because they're able to have those in-between visits to check in with their doctor and review things that they might not have understood. They're able to talk to their doctor about just how they're doing things and get clarification. And so we do see increased compliance in patients, and that decreased no-show rates. So not having to travel, not having to get childcare, not having to do those things actually allows a patient to be seen more easily. And they love that. And then, we're also seeing that there's similar outcomes for virtual visits, and we'll talk more about that too. And again, one study that I wanted to highlight was just this telemedicine use for pediatric asthma care done at UC Davis between March 2020 and September 2020. There was 502 patients in the study, and they looked at electronic health record analysis and a quantitative focus group analysis. And their findings showed that alternating telemedicine with in-person visits for asthma care may result in improved access to care and reduced burden on patients and families. So again, just highlighting that patients felt like they had more access to the provider and improved access to care. So now I'm just going to put out a patient case that our normal allergic patient, and a patient that I think can easily be managed mostly through telemedicine, and partly through in person. So a 30-year-old man with with a history of PTSD, asthma, chronic lower back pain, allergic rhinitis, conjunctivitis, history of nasal polyps, has had 2 surgeries and eczema. Frequent sinus infections for which he's had antibiotics. Patient smokes 1 to 2 packs of cigarettes per day, has had asthma since childhood, and recently noticed an increase in his symptoms with his allergies. He's been going in and out of the urgent care for his asthma. So this is, a patient that we typically are worried about and see often, and sometimes don't see often enough, right? Sometimes they are just in that cycle and never get in to see us because of multiple reasons. And for this patient, he's got a full-time job at a fulfillment center and never has the ability to really take time off to come and see a physician. And he's been prescribed oral steroids over and over. So he recently saw an article that talked about telemedicine and decided to see if he could get more help without having to miss work. So, one thing that I want to point out is obviously every state has different rules for new patient visits. So some states, you can't establish a doctor-patient relationship via telemedicine, and you do need to see them in person. So it really depends on the state that you're in. And we're not going to go into all of those rules because they vary so much by state to state, but that is something important that you need to understand for wherever you practice. And so, what can you do with just technology? You can embed a medical intake form, which I think a lot of us have already done, where you have them electronically fill out all of their medical intake historical data, and you have access to that before their appointment. You can also do screening questionnaires into the intake forms, like an ACT, AirQ, SNOT-22, all of those things, so that you have that data. And then the physical exam. What can you do? And I think physicians like Dr. Tanya Elliott, who have been also doing telemedicine for the allergic patient for years and years, there's many videos where she talks about all of the physical exam findings that you can find. But you can observe how they're breathing and talking, and then and that can give you a lot of information. You can ask them to open their mouth and even look into their throat. There's also devices that are available that can be used to listen to patients in their home. And then wheezing can also be monitored via remote patient monitoring devices. So that you can examine a patient through the internet is actually not true. There are many ways and tools available on how you can actually examine a patient through the internet. And then there's at-home diagnostics and wearables. So, these are great things that if we have the right tech and if we have the right support, we can really utilize a lot of information and help our patients in a more effective way. So there's electronic diaries where we can have patients record their symptoms and medication use. So oftentimes, and I find this for myself too, is patients, they just don't have time, or they just can't. Their recollection of their symptoms, their medication use is oftentimes flawed, and there's research to show that. And it's just everyone's so busy that it's really hard to remember what happened yesterday. And so what happened in the last month or the last 2 months or the last 3 months is even more overwhelming. So having a way for patients to be able to write down their symptoms, medication use, and then get that electronic diary into a system where then it's already there for you to review during their visit and just kind of quickly peruse. I mean, we're not asking physicians to look through, pages and pages of data, because that is not feasible. But if it's done in the right way, we can get a lot of information. Then there's wearable technology to monitor activity, vital signs, and things that can also help us. And I think Dr. Mosheim, who I'm going to mention later, has done a lot of work in, how can we find that patient that is not doing well before they're even not doing well. So what are the signs and in their vital signs and their activity that can help us determine that something is not going right? And then remote patient monitoring. So things like environmental exposures, medication adherence, all of those things can also be incorporated into the data that we bring into the visit. And then there's digital therapeutics. So these, again, the definition is evidence-based, clinically evaluated software and devices that can be used to treat an array of diseases and disorders. So for the allergic patient, I think the main tool, an asset that we have right now, are a number of different digital inhalers. There's digital inhalers, there's attachable sensors to inhalers that are already available that then link up to different apps and devices that we can then use to get that data back and help us understand what this patient is going through while we're not with them physically. And also can help us understand how well are they using their inhaler, and are they getting the most out of their medications. And this is actually from an article that Dr. Mosheim wrote with others that goes into digital devices and digital therapeutics and how they can be used for an asthma patient. So it's digital, so it's this article right here, digital inhalers and remote patient monitoring for asthma. So if you want to take a deep dive into the topic, this article really does it. It's very comprehensive and it goes through everything that you would want to know. And so I've kind of put the bullet points of things that I think are important to think about. So, or things that the article highlighted. So digital inhaler systems, like the ones that I just showed earlier, can serve not only as they can serve as a diagnostic tool and therapeutic interventions, obviously. So they're therapeutic interventions in that they're a medication, but then they can also help us diagnose whether or not the patient is has poor adherence or poor inhaler technique. So it can help us understand, is this patient truly uncontrolled, or are they just not using their medication, or are they not using their medication well? And so it can really help change the plan for the patient. And what they found is that this may specifically benefit newly diagnosed patients to establish good adherence and inhaler technique. So for that new patient, before they get into kind of habits that are harder to break, it may be beneficial to start them on a digital therapeutic early on, so that you can really help them understand the importance of adherence and the importance of good inhaler technique. And then also they found that it may help patients with difficult to control asthma to improve adherence and technique to avoid treatment with high side effects like oral corticosteroids or costly biologics. So we can find those patients that we think may be very severe and not managed on their current treatment. And, when they come in and they tell us that they're using their medication correctly and they're using it all the time, when you have a tool to actually say, you know what, actually, it looks like you're not using it all the time. You're not using it as effectively as maybe you thought you were. And we get it because you're busy, life is busy. And, but now we have extra data to help you understand that the way that you're using the medication is likely part of the reason that your asthma is not controlled. And in that, we can avoid, hopefully, patients getting on the oral corticosteroids or biologics ultimately. And then in this article, they also talk about when choosing a digital inhaler system for a patient with asthma, it's really important to take into consideration the preferences for either a built-in versus an add-on sensor. So is the patient just really used to the inhaler that they're using and they don't want to change the inhaler, the device, the medication, because then there's also that that psychological component that we always have to think about, where the patient is just knows that that inhaler works for them and they don't want to switch. And so does an add-on sensor make more sense for that patient than switching them to one of the devices that just has a built-in sensor? And then we also want to look at whether the system is able to detect inhalation quality. And healthcare providers also need to know about the inhaler, about how to teach inhaler technique, about the devices that they're giving to patients. So is there an app associated with the device? How do you pair with a mobile asthma app? So there's, on the patient's phone. So do you have somebody in your office that kind of takes over that aspect of it, takes over the teaching aspect? And I'll talk next about this, but there's actually billable codes that you can use when you're doing the onboarding of a patient to their digital care. So, and then if you're implementing these remote patient monitoring or remote therapeutic monitoring devices in large healthcare systems, or in small practices even, you want to maybe think about doing a pilot program to test the feasibility of the technology before you kind of put out this, very expensive program to see what is the financial impact, what is the patient satisfaction, are you actually going to get patients to buy into it in the area that you're in the patient population that you're serving. There is some data to show that patients where English isn't their predominant language, that a lot of these patients aren't as likely to use telemedicine or devices. And so why is that? And I think there's more and more data that's going to come out onto how can we help all of our patients feel comfortable using telemedicine, using devices, and what are the barriers that we need to overcome in order to make sure every patient is served. But all of these things need to be thought about. And then, of course, it's important to have policies in place to manage liability risks. So if you're getting a lot of data back from these devices and from these therapeutics, then it's very important to know how are you managing that data? Who's looking at that data on a regular basis to tell you that, this patient isn't using their medication? And should you have intervened earlier if you have them, if you know this data? And if you didn't, and there's a bad outcome, you just want to know, could you be liable for that? And so, the ultimate kind of message was digital inhaler systems, remote patient monitoring, remote therapeutic monitoring can empower patients and healthcare providers to improve ICS adherence and inhaler technique, and then hopefully ultimately improve asthma outcomes and reduce costs for our asthma patients. And now for the hot topic, which I am not an expert, but there's other physicians that have also done a lot of great talks on this topic. One of them is Sakina Bajwala. Dr. Bajwala has a lot of nice videos online, actually, through the college that go into coding and billing. And so, for remote patient monitoring, remote therapeutic monitoring, also Priya Bansal. So there are physicians that are using these technologies in their office and are sharing that information with us. And there's actually this article that the college put out, making remote patient monitoring and remote therapeutic monitoring work for your practice. So this article really is a great article that goes into a couple of clinic scenarios and where physicians are using these technologies, and how did they implement those technologies? What did they have to think about? What would you have to think about if you want to implement these technologies in your practice? So if you're interested in this, I would highly suggest looking at that, and then also looking at some videos from these other providers. But Essentially, remote patient monitoring CPT codes allow physicians to provide and be paid for monitoring of patient physiological data. So those are things like heart rate, respiratory rate, blood pressure, weight, spirometry. And that data then, again, is automatically transmitted electronically via a device for treatment management to the physician's office and or to a third-party provider that's managing that data for you. So again, these services can be provided under should be provided under general physician supervision, which means that a physician's clinical staff or an outside company can provide the services without the physician being in the office or on site. So again, you could either train or have a dedicated clinical staff member, or you could even hire, a remote staff member. I personally have had great experience using, for example, a remote nursing service out of the Philippines, where you can have staff there look at data for you and manage those kind of things, in addition to a lot of other things in your practice to help make sure that you're looking at the data and that someone's managing it. But all of that can, again, be paid for through these RPM CPT codes. So in that article that I was talking about, they have this nice chart that goes into the different codes that you can use. And again, I'm not an expert in this, but there are many people that have written nice articles on it, done nice videos on it that you could refer to. But again, you can get paid for the setup of the remote patient monitoring. So patient education on use of the equipment. And again, that's billable once, or supply of the device. And then treatment management. First 20 minutes and then every 30 days. So there's lots of nuances to all of this, but I think it's important if you're interested in it. For a lot of clinicians, it seems that it works for their practice. And once it's in place, you can make profit from it. And then the remote therapeutic monitoring codes that I got from Dr. Mosheim's article that I had talked about earlier. But there's different codes for that where, again, an initial setup code, supply of the device. So all of these things, the RTM, RPM codes, lots of things that you can learn and lots of important information that you can gather from all of these articles and these people that are have been doing it themselves. And then, patient communication and data collection. So you can see patients, again, more frequently to touch base with them through technology. And again, it's not always just that telemedicine synchronous visit. A phone call, a text, an email can also be considered telemedicine because you're asynchronously getting information from the patient and using that patient to help provide care. And so all of that, I think, is important to remember that now we can get paid for it, and we can more frequently touch base with our patients and help make sure that they're feeling better and doing well with their condition. So again, going back to our patient, I think now it's hopefully the picture is set for what could we do for patient SA? How could we help him manage his condition? So it might look like he comes in for a visit at some point when he has time, but in between when he's not able to, and if you're in a state where you can establish a doctor-patient relationship without physically seeing the patient, you could at least get him started on better treatment for his asthma. So you can, talk to him, you can see him physically on the video, see how he's breathing during the visit, see if he's coughing every other second during your visit. You can ask him about his entire history. You'll get this entire picture. And as you know, 90% of how we treat a patient is based, I think, on history. I think most physicians I talk to, history is key. You need to know what's been happening. You need to know what symptoms the patient's having. And the exam is only a small portion of how we make our clinical decisions. I would say most of it is based on the history. And so for this patient, we can get them on a better controller medication so that they're not going into the urgent care, into the emergency room and seeking care for their uncontrolled asthma. We can start their evaluation process for the, uncontrolled asthma. If they do, start on controller medication, but they continue to do poorly, we can do blood work to see if they have a high eosinophil count. And you can send a patient for blood work without seeing them in the office. You just have to write a requisition for blood work to go to places like Quest or LabCorp and get that and then get that data back, and then have another visit with the patient to review the blood work and let them know what it means. You can also send them for a full pulmonary function testing, or you could send them a spirometry device that you can teach them how to do their own spirometry at home via video. You could also have a nurse go into the home and do spirometry with the patient. There's service providers that do that. And for the allergic rhinitis conjunctivitis and the nasal polyps that may also be contributing to his asthma, we can definitely start him on treatment for that. We can send him for IgE testing if you truly can't come in for skin prick testing to see, does he have what are his allergic triggers? Can we make some changes in the home? And what I love about telemedicine visits is you can, the patient can go into their medicine cabinet, can show you their medications. It's not I don't know what I'm taking. It's okay, we'll just, go ahead and get up and go into your bathroom and show me what you're taking. Show me what your doctor, your previous doctor prescribed or the urgent care has given you multiple times. Let's see what you're using. And especially with the polypharmacy with patients with allergic rhinitis conjunctivitis that we know about, we can see, that nasal spray, those 5 nasal sprays that you have all have the same ingredient in them. And you can see that when they open up their medicine cabinet. So that's something that I like doing with my patients when they're feeling like they can't really tell me what's going on or what they're doing, or they're just, I know that they have a million medications in their medicine cabinet. I just have them go there and open their cabinet and show me what they're using. And I think that's one of the great benefits of telemedicine. And then for smoking cessation, you can also provide, great counseling and frequent follow-ups, because I think, as smoking cessation patients that are interested in that really do need frequent follow-up, and telemedicine is a great opportunity for that. So ultimately, I think we can do a lot for patient SA, even without physically seeing them in the office. And I hope that this lecture kind of provided an overview on all of the things that we can do for this patient, and how much we can help our patients. So the key takeaways is, for me, are that telemedicine is here to stay. I think hybrid care is essential in 2023 and beyond. In-home services and in-home monitoring offer benefits to patients and physicians. And direct-to-consumer care is also changing the landscape of medicine. And again, from my experience in it over the last 3 years, I really truly believe it's something that we need in this country, given the high cost of healthcare. And I think that the adoption of telemedicine is truly driven by patient preference, because patients just need something different. It's not for every patient. Some patients do like the physical connection. They do need to be in the office. But I think with our busy lifestyles and everything else, there are a large proportion of patients that really do love telemedicine and the convenience that it provides. And that's my son, Phoenix J. That was a long time ago. A lot has changed. He's changed a lot. But he was a big part of my journey. And I can say, for me, I chose to leave practice, leave the normal kind of clinic practice because I was pregnant during COVID. I had him in July of 2020. And I had to think for the first time as a healthcare provider, because I think a lot of us think about others before we think about ourselves, is for the first time, I had to think about myself. I had to think about my baby and how I was going to keep us healthy during this pandemic. And I think that, as much as patients benefit, we also benefited from feeling safe with telemedicine. And I made that huge shift because of him. And one day when he's old enough to understand it, I will definitely let him know that he was a big reason that I made this wonderful change actually in my life to doing more telemedicine and providing care in that way. So I think that the fundamental aim of telemedicine is really to improve access to care. And I think times have changed and things rapidly change. So this is a video of my son scooting away, and we really have to run to keep up with changing times. And I think I'm really excited about all the research that people are doing in the telemedicine space and all the information that we're starting to slowly get about how can we help our patients? What does this mean? How can we do it in the most effective way? So thank you. And I see that there's a lot of chats, so I don't know if those are questions or.
Thank you, Dr. Gupta. This was a fantastic presentation, and I really like your end synopsis there about really being able to transition to telemedicine. That can really help you and any other physician have that great balance in life between work and life and vacations and all sorts of other things. And this may be a way to help prevent some of the burnout. I don't know of any physicians that haven't had burnout, even before COVID. So love that part of your presentation. So we do have some questions, and I will read those off to you. So our first one is, are digital devices covered by state and private insurance? And if so, what about copay options? I know reps have told me that they are expensive, hence the coupon to lure people into device use.
Yeah, so again, this is a complicated topic, and I'm not an expert in this. And I think it's going to vary based on the insurance that the patient has, where you're located, all of that stuff as to how well, these therapeutic devices are covered. I think that as we have more data on how helpful they can be and how they can potentially reduce cost and reduce just generally cost. I think that's always the ultimate thing that guides things, is that not only to mention, patient improvement, but if we can show that, I think more and more these digital therapeutics are going to get covered by insurance, and the cost is going to be lowered eventually. And I think that's already happening, and I think that's going to continue to happen more and more. But of course, cost is a very important part of determining whether or not you want to do something like this for your patient. And that's definitely a shared decision-making element to all of this. Is, does it make sense to do a digital therapeutic if insurance isn't covering it? Is it feasible?
And you make a good point there about using the digital device, because we all know patients that have had asthma all their life, and you look at their inhaler technique, which is incorrect, and they've been doing it that way their whole life. So to try to help them make that transition into correcting their inhaler technique could be a good use of a digital device for them. So another question we have is, Teva discontinued ProAir, but is the DigiHaler still available for ProAir?
Again, I do believe, yes, that the DigiHaler is still available, but I'm not completely sure about that, but I do believe it is.
That's what I've seen on the website as well. So we have a question from a school nurse, and she asks, how can a school nurse get some of these things to help students understand if they're using their asthma medicines correctly?
Yeah, I mean, I think, as a school nurse, I'm assuming you're more managing the condition as a secondary provider, and that patient is actually being managed by their primary doctor for their asthma. For example, it might be their allergist, pulmonologist, or their pediatrician. And so I think if you think it would be helpful to a given patient, definitely bringing it up to their physician and seeing if it might be an option for the patient. I think that obviously in pediatric patients, device use is always a concern. And so having proper inhaler technique and those kind of tools available earlier is always important. But obviously it depends on the age of the patient and where they're at and how they might be able to use digital therapeutics, in their entire kind of game plan. But I do think that as a school nurse, if you think that that's something that you would be interested in, I would absolutely talk to some of the providers that are part of your patients kind of and see if they would be open to looking at that.
Good answer. Yes, that makes a lot of sense. So another question we have is, do you find telemedicine can address psychological needs of patients, such as the basic human-to-human support in a face-to-face setting? It can be a little bit different face-to-face versus digital.
Well, yeah, of course, things are different. But if I think for me, the biggest thing is that I think 2023, what the time that we're in right now, even my communication with my best friend, for example, my family, everyone is mostly done through asynchronous, through text messaging, like we're catching up with each other through text messages, but I still feel cared for and thought of through a text message, right? That's just one example. And I think Zooms and FaceTime calls with family members, with coworkers, et cetera. Obviously, you want to have those those in-person kind of meetups and things like that with family, et cetera. But I think that that's just a good example of how we're all used to this type of communication. And so there's actually, I think, and I haven't looked up the studies, but I know I passively got this information from somebody that in the psychiatry, psychologist space, psychotherapy space, they're finding that there's definitely more access if we do it through telemedicine, because I don't know, I think for most practitioners, when you want your patient to get in to be seen by a psychologist or a psychiatrist, it can be months. And so if we can reduce that time, because there isn't, the check-in process, this process, that process, and physicians are able to see patients in a more streamlined way through telemedicine, then we can provide more effective therapy. And I think, so yes, I absolutely don't think that we're missing that element with telemedicine. I think it's just obviously it depends on the person, but I just think in this time of our existence, we are communicating with everyone in a different way.
That makes sense. That's just another layer, not only family and friends and colleagues, but with our physician as well, to use that same platform. So another question we have is, I can see how digital MDI can count actuations and transmit. How does it critique technique? Can you explain to people how that works?
Oh, yeah. So again, I am not the expert in this, but there are some of the devices can actually monitor the inhalation, I do believe. And so that can give you information on on proper device use. So again, I'm sorry, I would have to defer that question a little bit, but I do think that some of the sensors and things can monitor the inhalation and how well it was done in order to provide that information.
Great. Great. And some of the things that I like that you talked about today is just really making it a lot easier for the patient. So in a lot of these states that are quite large and have a lot of rural areas, and it's a 3 or 4 hour drive to get to see a specialist. So when you talked about having them be able to go just to a nearby clinic and then for you to be able to connect on your other on your end, I think that's really helpful for a lot of people that don't even realize that that's an option, that even if you live in a rural area, you can still have access. And so I think that was one of the most important points about what you talked about today. And then another point I really liked is when you talked about people without insurance. And this could also, so would this also cover, I know some people that have a $7,000 deductible for their family insurance plan. So yes, they're insured, but they have to pay everything up to that $7,000 level. So this would probably be a good option for that as well, I'm assuming.
Yeah, it can be. And I think there are patients that supplement with these kind of things. And you can use your HSA FSA account, for example, for direct to consumer telemedicine options. So you can use them for, your HSA FSA for medications, but you can also use it for, using telemedicine through direct to consumer.
Perfect, perfect. And then another thing I noticed when you talked about the number of people that might go in person for their first visit, but once again, we have those people that are driving 2 or 3 hours to get to their specialist. But then the percentage of people that are going to switch and actually do telemedicine after that as a follow-up, I think is a brilliant idea. It will save everyone a lot of time and energy and getting babysitters and all those other fun things. And so have you found that to be really helpful, that initially you could meet them in person and then, or some of your colleagues, and then have them switch to more of the follow-up with the telehealth? Has that been a good success?
Yes, I think hybrid care is very successful. And I think that is what most physicians are doing. Again, I don't think there's many people that are doing just telemedicine, but yeah, I love that, where you can have that kind of physical connection with somebody and establish that relationship, test them for their allergens, do whatever diagnostic testing you think they might need. And then for follow-up of the blood work, of the, of their therapy, refills, all that kind of stuff, or questions, that they have. Again, I think for physicians, a lot of this stuff wasn't billable, but for me in my practice, I don't have a problem telling a patient that's emailing me. And actually, by the way, you can get, there are codes for, email communication now too, or maybe they've always existed and now people are looking into them more. But, I don't have a problem telling that patient that's going back and forth on email a little bit too much that, let's change this into a telemedicine visit so I can really understand what's going on. And we can just kind of come to a conclusion and a better therapeutic plan for you by using telemedicine. So yeah, I think that, again, I think that it's a good option for the patient, and it's a great option for the physician too, because we aren't doing work that we're not getting reimbursed for.
That makes sense. And that really helps you be able to individualize what each patient needs. Some might need a little bit more handholding and a little bit more help, and others you can whiz right through an appointment with them. So our last question is, people were curious about some of the devices that are used at home to listen to a patient in the home. Is there any information that you could provide about that?
Yeah. So, I just, again, I probably should have looked into this more for this talk, but I don't know too much about that. But there are so many companies that provide these services where you can actually do different things, where they will send out the device like a stethoscope kind of thing. So where the patient can put the device on their chest and, you tell them where to put it. And then that device then is picked up on your end. And so those devices exist, but also in those rural settings, that same kind of thing exists for the practitioner that's in that rural setting, in that rural clinic. They can put that stethoscope that then is linked electronically to the other, to the doctor's system, to the other physician, the specialist, so that the specialist can literally listen to the patient's lungs or heart with you. And so, yeah, those devices exist. I'm sorry that I don't have a full, I can't give you complete details, but I think that's the overall kind of picture that I have.
That's very helpful. We're just about done. We have one last question, and I'm just going to read the last end of it since we're running short on time. So someone is just asking how you can help if you have the people with the no-shows for telehealth, which is probably an issue in person as well as telehealth. But that'll be our last question, and then we'll just go ahead one more slide. But if you could address that.
Yeah, it's sorry. So it is so yes, so I think that reminders are very important. So whatever system you're using to let your patient know about their appointment, you just need to have, I know that the system that I use sends the patient a calendar invite. So it's in their calendar. The link is in their calendar. Everything's in their calendar in that link. And I think having that, maybe even having a system where you're texting them, if that's something that that you can do with your staff. There's online kind of like you can use Google Voice, for example, is a free service, or at least it was when I signed up for it. But I think there are still free plans where you can literally text through a Google Voice number to patients and send them reminders. So you could have, your assistant, your staff send messages to all of your patients the day before, or even the morning of, or even 10 minutes before their appointment, just to remind them. So I think, again, I found that even through the direct to consumer telemedicine company that I started, that people do respond and see their texts even more often than they see their email. And even more often than they're willing to answer their phones. So, I think text is a great way of sending reminders to patients.
I agree. Previous to coming here to Allergy and Asthma Network, I coordinated an asthma home visit program, and we had the same problem, even doing virtual visits, people that wouldn't show up. So we found texting was actually best. They could see it if they were on campus, they could see it if they were in meetings, and they could respond right away. And so we would do the same thing a week before, a day before, the day of, and I think that can help. So thank you, Dr. Gupta. Really appreciate you sharing all your information about digital health. If you'll just go forward one more slide, this is where you can find this. Next week, this will be on our website. This is what our main page looks like. Then you're going to scroll all the way down to the bottom, and that's what it will look like. It has a little yellow behind there, and you'll be able to find the webinar there. And please join us for our next webinar. One more slide, Dr. Gupta, if you could. One more. Sorry, we've got a few on here, and one more, and we should be there. There we go. So our next webinar will be what you should know. You can join us, what you should know about COPD, February 9th at 4 p.m. Eastern Time. You can register for our webinars at allergyasthmanetwork.org. Scroll to the bottom of the homepage to find the link to register, and you will also find all the links there for our recorded certificate. We've had a lot of questions in the chat about certificates, so just keep an eye out for your email the next couple of days. That will come out. We'll have all the information that you need about digital health. We'll also have links to other resources for you, as well as information how to get your certificate of attendance, as well as some of the continuing education credits. Thank you again for joining us. This is Andrea Jensen for the staff at Allergy and Asthma Network. Join us as we work every day to help people breathe better and have a better quality of life. Thanks, everyone.